Hi, I'm Pauline, your neighborly nurse practitioner. I've been meaning to do this for a very long time, and so I decided to do it tonight without planning anything because sometimes when you plan and plan, it never comes to fruition. So I'm just doing this because as I sit here and I think about patients, I've had many patients come into my office and just feel as if they are not getting enough information or explanation as to what's going on with their health. Sometimes they take their labs and they don't get an explanation as to what the lab is saying. And sometimes they get referred without even an explanation as to what was found and why they were referred. I work mainly in the area of rheumatology and physiatry. So I think it's a good idea for me to just help you to understand some of the data that is seen in your blood work and what we look at. So you go to your doctor at least once a year. You get some blood work. They say to you, your numbers are fine. Don't worry about anything. So what is it that they're looking for? One of the main category of blood work is called your CBC. CBC means complete blood count. And that simply means they take your blood, they count the number for each of your blood cells. And you have different types of blood cells. You have your white blood cells, red blood cells, your platelets. And then the white blood cells has what we call indices or differentials, meaning they're subcategories. And so they can take the count of those different ones. And then the red blood cells has associated indices like your hemoglobin, your hematocrit, the color of it, the size of it. And so we look at those numbers, and then there's the platelets. And then depending on what we find, then a specialist may do additional blood work on those for further analysis. But the basic things that your primary care provider would be looking for your blood count when it comes to your CBC, they're making sure that you don't have any anemia. There's no acute infectious process going on. So your white blood cells can tell us if you have an infectious process going on. Your red blood cells can tell us if you're anemic. And when you're anemic, you're not being oxygenated properly, because sometimes that's why you feel tired. And then also your platelets. If your platelets are low, you are more prone to bleeding. And if your platelets are too high, you're more prone to blood clots. And then the differentials or the subcategories of white blood cells, we look for different things like, are you having any infectious process? Then certain ones will be too high. Or if you're having asthma or some allergic process, certain ones are also high. And if your blood work, your blood numbers, your blood cell numbers are not within certain ranges, then we want to send you further to go have it looked at, especially if you're symptomatic, especially if you're having associated symptoms. And sometimes if you're not symptomatic, but they're chronically outside of ranges that are normal, then we want to say go to the hematologist and have a further look. So hope that helps. So to wrap up, what can your CBC tell us about you at a regular visit? Are you having any infection? Are you anemic? Are you prone to bleeding or blood clots? Or is your bone marrow producing adequately? Hope that helps. See you in the next video where I'm going to talk about what does your chemistry tell us about you. Have a good night.